Here's our Ask Dr. Rajani question of the day. It's a good one today. It has to do a little with the cheek and the buccal fat. Let's listen.
Hi, Dr. Rajani. My name is Amber. I just had a question about, I think I'm saying it right, buccal fat. Some people are getting it removed and other people are getting it transplanted so that they have perhaps more prominent cheekbones. I wanted to know what your opinion on either of those, actually both of those procedures are. Thank you so much. Bye-bye.
Okay, so she said removed, and then let me just check this out.
Getting it transplanted.
Transplanted. How, this is such a good question for so many reasons. One, we're going to talk about buccal fat reduction. Buccal, I mean, she said buccal. How do you know the names of this stuff? I barely know. There's so much stuff. And a lot of it's derived from Latin, and people pronounce it differently in Canada and here. Buccal fat reduction is what most people know it as. Very interesting. Some people are getting it taken out. Other people are getting it replaced. Let's go under the idea with fat, replaced with fat. So, what it is, buccal fat reduction. It's the fat that is right here below the zygoma or the cheekbone. It sits there and it can be removed quite easily, meaning it's not a long procedure. You're awake for it. I actually have a video on it, on the procedure being done. You go through the mouth, you make a little incision, you remove. It comes out fairly easily in most people, as long as you haven't had a lot of procedures in that area, particularly permanent fillers or sculptor in that area. It comes out pretty easily. Problem is, so that's what it is. One of the issues with it, of course, it's surgery. Once it's gone, it's gone. It's fat in the face, and it's when this is gone, it makes the cheekbone look more prominent. So it kind of sucks it in. A lot of people thought Bella Hadid had it. Many of the influencers talk about it, and it's pretty cool to watch the surgery. So a lot of people are intrigued by it. And you're removing something. However, one of the problems is, of course, there's a facial nerve, and that facial nerve, it's a cranial nerve that allows us to express, articulate, smile, and move, keeps us symmetric. And if you injure that nerve, that's a problem. Now, it's less than 1%. It's not that common in most people. That's one problem. Of course, you are removing fat. Fat, there's a finite amount in the body. Fat cells expand and they contract for a living. They rarely reproduce. It's not like you get more and more fat cells. So once this is gone, it's gone. Part of the problem and why people, just like a lot of aesthetic procedures, take breast implants. People get them, put them in, then they want them taken out. People get butt lifts. They get fat put in the butt. Next thing, it looks bad, like they got a bad diaper hanging down as they get older. They want it removed. They have loose skin. Maybe then they go to an implant. So you can see where this can go south very quickly. Once this is removed, as we age, we get sag here. Now you have a hollow here. Doesn't look good for some people. The other thing is, if you're fit, in shape, and you work out, you're doing all the things I tell you on this channel, a lot of times I'm adding sculpture and volume to the face because volume loss makes people look, I'm going to use the word old for simplicity. And this can actually make someone age quicker. A lot of people said that with Bella Hadid. For instance, she looks older now, or Ariana Grande, okay, looks older now. Maybe she had buccal fat reduction. So it can make people look older and then they want it replaced. Replacing fat is difficult because if you take fat, first you got to take it from somewhere, now you got a defect. People think, oh yeah, I got a ton of fat, I want it gone. If you're getting liposuction done, great. But if not, I got to take fat out of some part of the body and then put it back somewhere and you hope it lives. Every fat cell needs some blood supply to live. So a lot of it dies off. Now, fat has 10% stem cells in it, so some of the fat regenerates. That's the latest theory on fat transfer. But it's unpredictable. It could be 20%, it could be 80%, no matter how good people are. Some are better with fat transfer than others. But it's not predictable. I would much rather use something like Sculptra or a biostimulator that's predictable than taking fat from the body and leaving a defect. You'd be surprised, a lot of people don't like it. They come back, they're like, hey, where you took it on my belly and you moved it, I got a little divot there, a defect, and when I put a bathing suit on or I don't have clothes on, it's visible. People don't like that. So if you're getting liposuction, it's different, but just taking fat out to remove it, that's one of the problems with it. And then, of course, like I said, doesn't all take. And then you need a second procedure. Now you got another defect. And remember, you now have belly fat in your face. And belly fat is different than facial fat. Not to go into detail, but there's different types of fat in the body. You hear people talk about brown fat, white fat, different ways the fat metabolizes, or buttock fat in the face. And remember, take menopause, the fat responds differently in different parts of the body. So you get truncal or midsection obesity in menopause. The fat responds differently to the loss of estrogen and the hormonal changes. Very complex, not to go deep dive. I would rather, for most people, create a contoured cheek. For me, it's sculptor here. Some people will look good when you remove it, but a lot of people do have the regrets that I talked about. And then you need to pay for a product to put in here. And then of course there's the aging problem. So it might look good while you're 25 to 35, 40. As you age, this might not look good. And that's why people want it changed. Aesthetics is complex. So the surgeon can do the best job that anyone's done, doesn't bother the facial nerve, did the procedure perfectly. Patient comes back in the ear and says, I'm not happy. It's like a nose job. Number one dissatisfaction procedure in plastic surgery is noses. No one's ever happy with their nose. So buccal fat reduction, for the right person, it works well. You need to see someone who's skilled. It's pretty quick procedure, fairly painless, local anesthetic, but be sure it's what you want. You can then add things back if you don't like it. Fat might not be your best solution, although it is one of the options. Have you had buccal fat removal? Did you like it? In the comments below, let us know. If you like these videos, please subscribe. It helps me bring you more. And hit the like button. I'll see you on the next Ask Me. Take care.